in rural, and that there are boards as described in the Senate bill,
right.
and there are deep philosophical decisions that will be made around healthcare in a general sense and an individual sense, and that those philosophical decisions are not being made by you. They are being made by Ezekiel Emanuel and people like him who are in influential positions.
That's a good point.
And that a lot of this is it's open to interpretation. You know, and one, for instance, if I may, the advanced care planning consultation, which is caused a lot of concern among people. I have it right here in my hand, and I've read it, and it says.
What are you referring to there? That's the.
It's right there.
Is our bill?
This is the House bill.
House bill.
This is the House bill, which you heard a lot of the House bill is available. And this says right here that every 5 years they're going to sit down and tell people, you know, you can end it right now.
Yes, they will. Yes, they will. They won't use that word, but that's what they're saying.
Let her finish. Let her finish.
It's a euphemism.
Any individual involved has not had a consultation in the last 5 years. Such consultation shall include the following: shall include an explanation by the practitioner of the continuum of end-of-life services and supports available, including palliative care and hospice, benefits for such services, an actionable medical order done either by a doctor or a health practitioner or a physician assistant. In other words, it doesn't have to be a doctor. And indicating a limit to some or all specified indication, specified interventions or treatment, including artificial administered nutrition. Well, that's fine. Everyone should have an end-of-life directive, but it should be done in the bosom of a loving family.
One of the ways to walk through some of that language, I realize it's the House and John Isaacs and the House, but my understanding as to what we're part of what the House is trying to do, part of what was part of the language that John Isaacs was worried about was that if someone wanted to get that kind of advice from experts with their family in the room and having that kind of discussion, these are terribly, I can't even imagine these discussions that people have. But that at a minimum, if you bring in a team of experts, you never come for free. In other words, you wanted to make sure that at a minimum, if someone wanted to engage in that conversation, and society wants to encourage those conversations, that it gets paid for, that it gets covered. But I'd say, compare this to the House and read what people like John Isaacs have said, because I think it's based upon his experience long before he got to the Senate. He's not a doctor, but he had a real concern that this was being skipped over, especially in terms of coverage. In other words, you shouldn't be patting your pocket to have that kind of conversation if you want to have it. Okay.
Oh, come on.
Okay, I'm going to let you go.
Come on.
We as a society need to value the elderly. We do not need to get rid of the elderly. And that's the problem.
Okay.